This is Selma Schimmel in Chicago for the Group Room. We're at the 2012 Multidisciplinary Symposium in Thoracic Oncology, which is brought to you by ASTRO, IASLC, ASCO, and the University of Chicago. I'm so happy to be joined by Patti Palmer, who's a medical oncology clinical nurse specialist at the University of California, Davis Health System. Hello, Patti.
Hi.
Talk to us a bit about how your work and these advances in lung cancer have impacted you.
My favorite thing about oncology is there's always something new to learn. It never, ever, ever gets boring or stale, and it's become more complicated, and I've been doing this for 39 years. So I've seen the worst of times, and now I think we're seeing the best of times. And as complicated as it is, it makes it really important that you understand the genomics as best you can so you can explain it to the patient, because it's like a course in biology for them to understand all these molecular markers and all these new drugs.
Let's talk a bit about how the role of nursing research, or the nurse researcher, is impacting patient care.
So nurses look at different problems than physicians do. Nurses look at supportive care problems. They look at symptom management and coping and distress and fatigue and the stigma of lung cancer. And so my physician colleagues, while they're mired in this incredible science of what lung cancer has become, my focus is more on the supportive things that help the patient experience be better. And all nurses' focus is that.
Also, the research that oncology nurses do in lung cancer has to be evolving.
There's a relatively new research grant that ONS has offered with the National Lung Cancer Partnership since I think 2008, and specifically offering $50,000 a year for specific lung cancer projects. And one of those projects recently looked at the sleep patterns in lung cancer patients, newly diagnosed lung cancer patients. And what they did is they interviewed lung cancer patients about their experience with their diagnosis and found four themes. One, that the diagnosis, while devastating, wasn't a surprise because the majority of them had smoked and they said they expected it. And even though they had advanced stage lung cancer, the majority of them chose treatment because hope was very important to them, and that they wanted to live their life fully and not be encaptured by their cancer, and that even though they were having sleep difficulties, they didn't think they were any different than their normal sleep difficulties, even though the majority of them were having insomnia and flight of thoughts and having trouble sleeping and impacting their quality of life.
Yeah, I would imagine that those sleep disruptive disorders would be common with any cancer diagnosis. Right?
But because of this grant through ONS, these researchers were able to look at that and elucidate those things. I do a support group at UC Davis, and so I asked my support group this week what they wanted when they were diagnosed, what they would have liked when they were diagnosed. And surprisingly to me, because I'm an information person, I like to give as much information as anybody wants. I usually tell people you could know anything you want to know, and I'll go as far as you want to go. And they all said that they wanted less information in the beginning, that they wanted it to come slowly and let them absorb it. But the overriding theme was this theme of hope, that whatever information they got, they wanted it to have hope involved. And I think oncology nurses are involved in that hope, but it was really an overriding theme, and it was in this article, and the patients reinforced it to me this week.
We've been talking about this multidisciplinary team for lung cancer. Clearly the oncology nurse is pivotal to really the structure and in some way the glue that really holds together this multidisciplinary team.
I don't know if they'd ever admit it. I used to have a boss who said the oncology nurse was the umbrella under which everybody else evolved. You know, that you, and especially as a clinical nurse specialist, I'm a system expert. That's my job. I know how to make the system work to take care of the patient. And that's what I do. I make the system work to take care of the patient.
Another area that I think nurses, oncology nurses, can have great impact is in helping educate patients about tissue collection and the importance of biospecimen research.
Lung cancer, I think, is going to be the first cancer that's completely individualized therapy. And my boss, Dr. Gandera, often says there's no lung cancer that's exactly the same. They're all different. And I would have never guessed, had I had a crystal ball and looked forward 20 years ago, that this is where we'd be with lung cancer today, that it would be so individualized. And the tissue specimens are ultimately important because the more targets we identify, the more chance they have of developing medicines to address those targets and ultimately cure lung cancer, which I never thought I would say, ever.
Because there's all this fabulous advancement happening in the area of lung cancer, with the nursing shortage as it is, this would be such a compelling time for someone who's considering a profession to consider nursing and to consider lung cancer oncology, thoracic oncology.
Yeah, I was the median age of nurses across the country. I think I'm probably a little older, but there's a bunch of us that are going to be retiring soon, and it's going to leave a big hole that is going to need to be filled. Besides the fact that nursing is pretty economy proof. Nursing is a profession that stays employed through all kinds of ups and downs, but lung cancer particularly is a great opportunity, and the doors are wide open for anybody who wants to specialize.
Patti, anyone who watches this interview with you will no doubt feel inspired.
Thank you.
Thank you.